everyone, and welcome to Medical Minute, sponsored by Kroger Health. I'm Sherry Hughes, and this is episode 62. Glad to be here with you all today and have a special guest. And today we're going to be talking about the future of medicine, and she's here. This is the future of medicine, Ellie Farley. Ellie, welcome to Medical Minute.
Thank you. Thank you for having me.
And we're saying you're the future because Ellie is a third-year medical student at the University of Cincinnati, and you're the future of medicine, Ellie. Tell us a little bit about yourself.
Yeah, so like you said, I'm a third year at University of Cincinnati. I grew up in northern Kentucky, so right across the river from here, so this is home for me. I left for a little bit to go to college at the University of Louisville and then couldn't stay away, so I came back and here I am.
Well, we're glad to have you back here and being able to talk to you today about the future of medicine. First and foremost, do you know of anyone in your family or friends that has actually had that cancer diagnosis?
Yeah, so actually my mom had thyroid cancer when I was pretty young.
Did that help influence your decision to become a doctor?
I think it definitely played a role. My mom, I guess, quote unquote, became a health nut afterwards, and we all are very focused on health in our family. A lot of us are in medicine, and I think that definitely played a role in all of us.
So that's a part of your why then.
Mm-hmm.
Sure. Are there other reasons that led you to perhaps your pursuit in studying medicine?
Yeah, I grew up always loving math and science, and I danced my entire life, played soccer my entire life, and so I always was really focused on health and wellness and how the body works and how it moves, and that was always just so interesting to me.
What discipline? I know you, as a medical student, you're doing rotations right now. Mm-hmm. What is next? A residency? And if so, is there a focus, a specialty?
Yeah, so after this will be residency. I still have one more year of medical school and then residency. I'm interested right now in plastic surgery and radiology are my two kind of top.
So in plastic surgery and radiology, both of those would lend its support to the field or the world of oncology. Mm-hmm. I'm a cancer survivor, and you say plastic surgery. I can tell you right now, I had a problem with my port. Okay. My body rejected it. And I went to Dr. Dale, and she actually cleaned it up for me. I don't know if anybody can see it right here.
It looks awesome.
This is looking good compared to what it did look like, and I was very pleased with the work that Dr. Dale did. And so that might be a part of what you're doing if you decide to do plastic surgery.
Yeah, plastics plays a huge role in cancer, and specifically breast cancer, because of all the reconstructions they do, mm-hmm. and they do a lot of awesome stuff.
And also radiology, mm-hmm. That's huge as well, because a lot of cancer patients have to undergo radiation treatments.
Scans become a huge part of, tracking if there's metastasis, seeing mm-hmm. if it's coming back, seeing if you're cancer free. So it's a really cool field.
Ellie, I love your energy, and I think that's so important. I had an immediate connection to you when we first met, and I think that connection to patients is so important, that doctor-patient mm-hmm. connection. Do you think that's important as well?
100%. I think in health, you're talking about a lot of intimate and vulnerable things. And if you don't trust the person that's supposed to be taking care of those things, then you're not going to have a good outcome. So mm-hmm. I think it's really important to create that environment. What
in medicine, as we're looking at it right now, there's so many advancements, so many things that are helping people live healthier and longer. What advancement out there excites you most?
One of the things I like is the focus on the whole person and not just the problem you're coming in for. And so I think we're doing a much better job of incorporating multidisciplinary teams into taking care of these patients.
Yeah, and right here at CCA, we have our team of oncologists that give consultation and referrals, and we do the second opinion. Mm-hmm. Do you think second opinions are helpful with, when people are going through their diagnosis? And you talked about the whole team mm-hmm. coming together.
Yeah, I think definitely second looks are helpful. Medicine is a collaboration, and so you need multiple people giving their input. I mean, we all went through a lot of the same training, and we're all very smart, and we want to work together and come up with the best solutions. And I think you can only do that if you use each other and use your colleagues.
We're really excited that here we don't charge our patients. Mm-hmm. Our patients come in and they get free awesome. Second opinions. And of course, our donors are fantastic because they are the ones that make it all possible. But access is extremely important. If you could change one thing about healthcare as we know it today, what would that be?
Oh, man. That's a really tough one. Uh-huh. I think the one thing I would change, it all goes back to access. Yeah. I think people don't, primary care is very important to prevent these chronic conditions that people struggle with their entire lives. And I think where we lack is making sure that everyone is seeing their primary care doctor when they're well, so that they can do all the things for themselves before they get to be sick and need the help.
Yeah, most definitely. You know what? You're to be a woman in the field of medicine, that's huge, because I believe looking back at some data is early as the early 1990s. There were only about maybe 37% of young women in medical school as first year medical students. Yeah. And last year there was 50%. So gosh, we've made great gains as women in medicine, and you're a part of that. Right now, though, there's only 37% of women across the whole country that are physicians.
Yes.
So, but you're on your way there.
It takes us a while to get into practice. So,
yeah. Are you daunted at all by the fact that you're female and it seems like it's a male-dominated industry still, or are you hopeful because there are more women coming into the fold?
Hopeful because there are more women coming into the fold, and especially my class is majority women. And so once we are out into the practicing world, we'll contribute to that higher rate of female physicians. And I also think there's some specialties that are lacking behind. And so I think it'll be cool once we kind of infiltrate all the specialties.
Oh, that's right. That's right. That's right. Because who knows? Maybe I'll be sitting in your office one day and you'll be treating me. Yeah. Is it exciting what you are seeing now in terms of medicine and how people are living longer, and that you may actually play a very significant role in that?
It's very exciting. And especially in cancer, when we're treating patients, we focus more on the longevity and the long-term effects of chemotherapy and radiation, because patients are living longer. And so we care about that. And so I think that shows a lot to what we're doing for patients, because they are living those years.
Yeah. Ellie, when I say something like you are the future of medicine, does that scare you? Or does that make you feel like, yes, I'm going to be able to really make a difference
I think
for
it's
somebody?
A little bit of both. It's a lot of pressure, but I think it's important to have high goals. And so I think you should have high goals for yourself in whatever you do. And so especially in medicine, I think it's cool to be a part of that. If
you could talk to cancer patients today that are perhaps listening to us, or somebody that's hearing that diagnosis for the first time, what would you say to them?
I think twofold. I think one, advocate for yourself. You know yourself, be a part of the team. Don't just let your providers make all the decisions. This is about you too. So you should really be a main focus of it. And also just be hopeful, be confident in all the advancements that we've made in cancer treatment, and really use the people around you who have also experienced it.
Yeah. Well, you know what? We're so happy that you dropped in to see us. We're going to try to talk to more medical students and some of the younger generation, because you really are the future. And I know that when you are that physician, whatever your discipline you decide on, and you're seeing your patients, I know they're going to feel very hopeful because you're just delightful and you're incredibly smart. So thank you so much for, doing what you're doing and for trying to improve the health of people everywhere.
Thank you so much for having me. It's been a blast.
Hopefully you'll come back and see us again soon. Okay.
I would love to.
Okay. Thank you, Ellie. And thanks to all of you for joining us on this episode of Medical Minute. Be sure to share it with your friends and subscribe to. I know I'm going to have Ellie sending this out to all of her friends.
I will.
And your family too, right? Okay.
I'll force them to watch.
Yeah. Thank you, Ellie. And thank you all. See you again next week.